Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Pericardial disorders. Introduction. The pericardium is a membrane or sac that surrounds your heart. It holds the heart in place and helps it work properly. There are many disorders that can affect the pericardium. Treatment for pericardial disorders depends on the cause. Treatment may include medicines, surgery, or other therapies. This program explains common pericardial disorders. It covers symptoms of pericardial disorders as well as treatment options. The pericardium and heart. The heart is responsible for pumping blood to all the organs in the body. It is a muscle that must work continuously, without rest, for a lifetime. The pericardium is a membrane, or sac, that surrounds the heart. It is made of two thin layers of tissue. Between the two layers is a small amount of fluid. This fluid keeps the layers from rubbing against each other and causing friction. The pericardium holds the heart in place. It also helps the heart work properly. Symptoms. Many pericardial disorders have similar symptoms. The main symptom is chest pain. The pain may feel like a heart attack. If you have chest pain, you should seek emergency medical care right away. Other common symptoms of pericardial disorders are fast heartbeat, difficulty breathing or shortness of breath, tiredness. Some pericardial disorders may also cause fever, coughing, swelling in the stomach and legs. Talk to your healthcare provider if you notice any of these symptoms or other changes. Finding a problem early makes treatment easier in most cases. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Pericarditis. In pericarditis, the layers of tissue in the pericardium become inflamed. When this happens, the tissues can rub against the heart and cause chest pain. In many cases, the cause of pericarditis is not known. Viral infections are a common cause of pericarditis. Bacterial, fungal, and other infections also can cause pericarditis. Other possible causes of pericarditis include autoimmune diseases, including ulcerative colitis, certain medical conditions such as kidney failure, HIV, AIDS, and cancer, heart attack or heart surgery, taking certain medicines, trauma to the chest, prior radiation therapy to the chest. Pericarditis can disrupt your heart's normal rhythm or function. Rarely, it may lead to death, but most cases of pericarditis are mild. Mild cases of pericarditis may not require treatment. They may clear up on their own or with rest. Over-the-counter anti-inflammatory medicines can help reduce pain and inflammation. Examples of these medicines include aspirin and ibuprofen. You may need stronger medicine if your pain is severe. If pericarditis is caused by an infection, you may be given an antibiotic or other medicine to treat the infection. You may need to stay in the hospital during treatment for pericarditis. This lets your healthcare provider monitor you for any complications. If complications happen, you may need other medical procedures or surgery. Talk to your healthcare provider to learn more about treatment for pericarditis. Pericardial effusion. Pericardial effusion is the buildup of fluid in the pericardial sac. This causes pressure on the heart and prevents it from working properly. If left untreated, pericardial effusion can result in heart failure and death. Pericardial effusion can happen if the pericardium is diseased or injured. This causes inflammation and a buildup of fluid. In some cases, fluid can also build up around the heart without inflammation. Pericardial effusion may be caused by a buildup of blood after surgery or an injury. Other possible causes of pericardial effusion include a buildup of waste products in the blood due to kidney failure, autoimmune disorders such as rheumatoid arthritis or lupus, radiation therapy or chemotherapy treatment for cancer, viral, bacterial, fungal, or parasitic infections. Pericardial effusion can result in cardiac tamponade. This condition happens when one or more of the heart's chambers collapse due to a buildup of fluid. Cardiac tamponade is a life-threatening condition. It happens when blood that is rich in oxygen can't reach other areas of the body. Treatment for pericardial effusion depends on many factors, including how much fluid has built up, the cause of the disorder, how well the heart is working. Treating the underlying cause of pericardial effusion often corrects the problem. Treatment can include medicines, draining the fluid, surgery. Anti-inflammatory medicines can help reduce inflammation of the pericardium. These medicines may be given when the heart is still working normally and not much fluid is built up. You may need to have the fluid drained if the heart is not working normally or if you have a lot of fluid built up in the pericardium. A needle is used to enter the pericardium and place a small tube called a catheter to drain fluid. This procedure is called pericardiocentesis. Sometimes open heart surgery may be needed to drain the fluid and repair any damage. Surgery may also be done to remove the pericardium if pericardial effusion happens multiple times. A procedure to seal the layers of the pericardium can also prevent pericardial effusion from happening again. This procedure is called intrapericardial sclerosis. A solution is injected into the space between the layers of pericardial tissue to seal the layers together. Dressler Syndrome. Dressler Syndrome is inflammation of the pericardium that happens following heart surgery or a heart attack. Dressler Syndrome is less common than it used to be. This is due to improved treatment for heart attacks, but once you have Dressler Syndrome, you are more likely to get it again. Dressler Syndrome is related to an immune system response to heart tissue damage. When the heart tissue is damaged, the body reacts to the injured tissue by sending immune cells and antibodies to repair the damaged area. Sometimes the immune response can cause too much inflammation in the pericardium. This results in Dressler Syndrome. Dressler Syndrome can lead to serious complications. It can affect the way the heart works and cause cardiac tamponade. It can also cause scarring of the pericardium, which restricts the movement of the heart. Treatment goals for Dressler Syndrome are to manage pain and reduce inflammation. Often, over-the-counter anti-inflammatory medicines are tried first. Prescription anti-inflammatory medicines are also available. These medicines may be used when over-the-counter medicines do not help. This is due to the risk of side effects after a heart attack or heart surgery. If fluid buildup in the pericardium is due to the inflammation, it may need to be drained. In some cases, the entire pericardium may need to be surgically removed to allow the heart to work normally. Some healthcare providers may prescribe an anti-inflammatory medicine after heart surgery to prevent Dressler Syndrome.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The pericardium is a membrane, or sac, that surrounds your heart. It holds the heart in place and helps it work properly. There are many disorders that can affect the pericardium, including pericarditis, pericardial effusion, Dressler syndrome. Many pericardial disorders have similar symptoms. The main symptom is chest pain. The pain may feel like a heart attack. If you have chest pain, you should seek emergency medical care right away. You may be having a heart attack. Other common symptoms of pericardial disorders are fast heartbeat, difficulty breathing or shortness of breath, tiredness. Treatment for pericardial disorders depends on the cause. Treatment may include medicines, surgery, or other therapies. Fluid may need to be drained from the pericardial sac. The layers of the pericardium may also be sealed together. Pericardial disorders can result in serious complications. Talk to your healthcare provider if you have the symptoms of a pericardial disorder or other symptoms.
Thank you for using Explain.